Hello, good afternoon. I'm your host, Dr. Festus Osai, the National Coordinator and the founder of the Medical Ultrasound Forum and the National Ultrasound Scan Training Facilitator here in Nigeria. By the grace of God, we have been able to travel across a lot of states in this country. We've covered more than 10 states across the country, distributed across the country. And what we'll be doing is to preach ultrasound scan, to teach ultrasound scan, of course, for people to upgrade their practice in ultrasound scan. And the aim of this is very simple, to use this skill to save life and, of course, to improve the ultrasound knowledge here in Nigeria. I'm your host once again, Dr. Festus Osai. The last time I talked about something very important, talk about how to avoid the medical legal challenges in ultrasound scan. Wrong ultrasound results can bring down a facility, no matter how big it is, no matter how small it is. Wrong ultrasound scan can bring down any medical practitioner, no, irrespective of your subspecialty. So you need to be careful how the results are sent in. You need to be careful when you take the full step-by-step procedures to make sure you don't fall a victim of medical legal challenges when it comes to ultrasound scan. In that section, the last video I shared on how to prevent the medical legal challenges, I gave 20 points on how, ways on how you can avoid those challenges. There are more, but these 20, if you study them very well, you'll be able to know what to do to avoid it, and if you get into it, to know how to come out of it. Ultrasound scan is highly operator dependent, but that is not an excuse for you to make some certain mistakes. But you need to know the basics, the principles that will guide you. I'm your host, once again, Dr. Festus Osai. One of the ways you can avoid medical legal problems is how to do it, sending images for possible review. In other words, to have a second opinion. Some people across the country do send me images for review. There are some I review, some I'm not to review, because the way and manner the images are sent, anybody can make a mistake on interpretation. One person, one patient can be scanned by 5 persons and they come out with 5 results. Why? Because ultrasound reports are highly operator dependent. So the way and manner these images are sent matters for possible review. And one of the ultrasound reviews, one of the most difficult review you can think about. It's easier than CT scan by MRI and the rest, because those ones are still images. The machine have done a lot for you. But if as a professional, they send the patient for you for review, if some certain things are not done, you are bound to make mistakes. So be careful when you review, and also be careful when you send patients for review. Now, I want to look at the step-by-step things that you need to know when you want to talk about send images for review, as you can see. Now, before I forget, come the 30th, Tuesday on the 30th of August to Friday on the 2nd of September, we're going to be in Lagos for another phase of the Lagos Ultrasound Scan Training Workshop. And it's going to be at a very comfortable place, spacious place, nice car park, good security. No, it's going to be in Surulere at the National Power Training and Institute. That's the place. We had it last year in Lagos and it was awesome. That is the place we had it. And they have a lobby somewhere you can go and relax in between the training sessions, and you can have time to relax. And the place have a spacious, that's it, can accommodate as much as 40 persons comfortably in that hall. This was the one we had last year. It was quite awesome. So that's a nice place I want to. So I want to, those of you in Lagos, take the opportunity of make sure you capitalize on this opportunity to be part of this training workshop. And one thing that's good about this one is that we have partners that have decided to sponsor the program so that the cost can be down. And for that reason, the early birds they have given 25% discount for the early birds. And that will be ending in the next few days from now. So take opportunity of that window. Of course, those of you that have registered before, please send us your payment details and, of course, your names so that you can be registered there as well. So just take note. There's quite a lot to be done, And I want to thank the Association of Nigerian Private Medical Practitioners, Lagos State Branch. I want to thank the chairman, Dr. Makinde, and, of course, the wonderful secretary, Dr. Debo, for their support. We are doing it in conjunction with them to make sure that this can be a way of empowering the Lagos State branch members of this great association. So we're going to look at that. Now, what are the things, before I forget, the book. Please don't just scan. Scan with books that can assist you when the need arises. And one of the such books you talk about is this, my book, the second edition of my book, Obstetric Ultrasonography, Basic Principles and Techniques. From these persons all over, you can get the book. So when you get the book, just call them, or you can call me, or you can WhatsApp me, and I'll tell you what to do, how to get the book. Anywhere you are in Nigeria, we can get the book across to you. A lot of people have collected the books, but you that have not collected, what are you waiting for? Now I want to look at The ultrasound images for review. What are the ways the ultrasound images can be sent for reviews? You can have an intra-ultrasound scanning reviews, and of course, you can have a post-ultrasound scanning reviews. The intra-ultrasound scanning reviews are the ones you send while the patient is still on your table or we're still on the couch, lying down on the couch, and as you're scanning, you're sending the images. As you're scanning, you're sending the images for review. And that can be done through the frozen images and of course through live videos. So what you can do. Sometimes you may have an emergency right there on your table and you need a second opinion. No panic, no problem. What you need to do is just tell one of your nurses or your assistant, your chaperone, focus the camera on the screen and you take a video, you clip you through WhatsApp or through all these means, what I'm going to tell you now, you send to us, we'll look at this and we'll review it and tell you exactly what it is. We've done that for quite a lot of persons and they are happy indeed. Or you can send what? Through frozen images. Then sometimes, if it's not an emergency, you can send it through printouts. Maybe through the thermal paper you send in to the next person, maybe the next day or the next following day, or through recording videos. Use flash drives, CDs, and the rest. It can also be sent. Now you can go it through like just soft copies, like I've just mentioned earlier. Then it can be live videos. You can use WhatsApp, the Telegram, or even Zoom. Although you have to take permission from the patient so that they feel comfortable. Tell them, look, I want a second opinion of this kind I'm doing now. I'm sending it to somebody across miles and miles away. But thank God for technology. It has made things quite easy. Another way of telemedicine. Now, what are things you need to look at? When you send the patient for review, it's important to talk about the relevant biodata. It's important. The good name, you may not be necessary. You can just put an abbreviation. But the age of the patient and the sex is important. You don't just send a scan and say, look, please interpret this scan for what do you think? No age, no sex. It's important to put those two things are very, very important. Then, in some cases, we need to know about the occupation, the religion, the marital status, the tribe, the address. Now, with the history of COVID-19 and all this pandemic challenge we have in the world today, the history of travel is important. There are some certain disease conditions that are prevalent in some certain areas. And there are some certain disease conditions that are prevalent among some certain age groups, among some certain race, among some certain the age. So when you are doing this, if you go for an idea as you are scanning, if you see something new, we can easily tie it down to one of these things you are talking about. Mind you, let me tell you the truth. Ultrasound scan is not done in isolation. The results you're getting must connect to something. And that is why all these things are quite important. So it depends on the kind of patient you have, or the situation you have on ground. You don't know exactly what to do and what to send at that point in time. Then in females, always write the LMP, the last menstrual period. Very important. Take, for example, now, this is ultrasound scan, a sagittal view of ultrasound scan of the uterus. And there's a mixed echogenic tissue in the mid cavity. This can be anything. It can be hematometrium, it can be retained products, it can be a case of endometritis or whatever. So the LMP is important. If, for example, the LMP is 6 weeks ago, bleeding per vagina, the next thing you're likely be thinking about is what? Retained product of conception. So these are the things that are quite important. Then the parity of the person is important as well. That will help us to make our something diagnosis. Then the patient's complaint and the history. And of course, depending on the type of scan, bleeding per vagina, it could be abdominal pain, abdominal swelling, fainting attacks, amenorrhea, difficulty in breathing. Sometimes you can have a case of road traffic accident, fall from a height, gunshot injury, stab wounds, post-surgical complications. With all this history, it tells us where to focus our attention on. Of course, this is not meant to distract you, but it's meant to tell you where to focus your attention on. Take, for example, now, if you have a case of a cross injury or a road traffic accident with a cross injury, what the sonographer or the sonologist want to look at, to focus on intra-abdominal organs. Look at the spleen. Could there be a splenic rupture? That idea is quite important. They talk about the issue of amenorrhea, fainting attacks in a woman, talking about the LMP. Could it be a case of an ectopic pregnancy? So you already have an idea of what you are doing before you go in and start scanning as well. Of course, laboratory investigations become important. Then you need to tell us where actually the scan was, what parts you saw the mass or saw whatever you're scanning. It can be at the umbilical region, can be at the left or right lumbar region, it can be at the hypogastric region. So if you send an image to us, let us know where the image was gotten from. It's important. You state that, it will now give us an idea correlating with the surface anatomy of the expected organs that will be in this region. Then one can easily tie down the diagnosis. Now, of course, you may be familiar with the anatomical place as well. Now, as you're sending the images, remember the ultrasound images are highly operator dependent, and that's what talking about this picture here. That's an individual here looking at the screen, studying what's in the screen. interpret what's in the screen. But mind you, whatever he's doing here depends on what the hand motion and the control of the machine is going about. If it gives up something good here, we'll have something good. But if the hand is not good, well, of course, we'll not have something good to interpret. So whatever the man interprets here depends on what he sees here. So it's highly operator dependent. You can see just one individual watching, controlling the hand, scanning the patient, of course, thinking of what could likely be, and of course, making an interpretation. So these things will really help whenever you're scanning. That's why you need to be more careful when you're signing the results report for review. And take note of navigational techniques. You need to know how to navigate. If not, you'll be lost along the line. This is a road here. If you're trained along this road, you don't know how to navigate. What happens? Or when you are sailing the sea, of course, you'll be lost. Your sagittal view should be sagittal view. Your transverse view should be transverse view. Of course, these are quite important when you are scanning. Now, on the sagittal view, let us know what you're seeing is on the sagittal view. And you know, for the sagittal view, we need to know which one is superior and of course, which one is what? Inferior. With that, we can easily interpret what you're seeing on the screen. Now, take for example now, this is a sagittal view of the uterus, as you can see here. And this is the mid cavity. With this one, I can say a lot about this uterus, about this ultrasound scan. This is another sagittal view of the uterus. Okay? Now, this is a baby in the uterus, the fetus. I can say a lot looking at this scan as well. So the navigational techniques you're using is quite important. Now, this is what we call the transverse view. In transverse view, we talk about right side and left side. In sagittal view, we talk about what superior and what inferior. So just take note of that. So whenever you are, tell us which view you are giving us. Is it sagittal view? Is it transverse view or thereabout? Now, let's look at some examples. Take, for example, this one now. This is the bladder. This is the uterus. From this view, if you say, man, this is such transverse view of the uterus, please, can you give us an interpretation? You give us the LMP, you give us the complaints of the patient, and one or two information. Then we can arrive at a diagnosis. Now, look at this. This is the uterus here. From this, I know this is the right ovary, and this is the left ovary with a cyst, because it's a transverse view. Okay? And the landmark here for us is the uterus. Now, this is another transverse view, the uterus, and of course, the urinary, of course, the what? A cyst, that's the urinary bladder. So the view you are giving us is quite important. Take, for example, now, look at this. If you tell me this is a sagittal view of the uterus, then I will lose out the diagnosis. I'll be wondering what could this be. But when you state categorically clear that this is a transverse view of the uterus, I know this is an example of what? A double what? Uterus, uterine diadelphys. There are some certain views that are better in making some certain diagnosis in scan as compared to others. Now look at this. This is a sagittal view of the uterus. With this one, I know that, look, there's a fluid in the cervix through the vaginal end. So I can now make my interpretations clearly as well. Okay, now look at this. Once you tell me this talk about the, okay, now if you're scanning, you should look at a plane that an organ can best be interpreted. For example, if you want to look at the uterus, the cervix in terms of the uterus, sagittal view. If you want to look at the ovaries, to know which ovary you're looking at, you go by what? A transverse view. Now look at this. This is a sagittal view of the kidney. And because the sagittal view of the kidney, I know that this is the upper pole of the kidney and the lower pole of the kidney. No, don't worry, because the way it's slanted, like you think this is the upper pole. This is not the upper pole, this is the upper pole of the kidney. Mind you, this is always superior and this is always what? Inferior. Now, if I'm scanning and I say this is a sagittal view of the kidney, and what am I seeing? And I'm seeing a cyst. Where is the cyst actually situated? At the upper pole of the what? Kidney, based on the what? The view we are trying to look at it at that point in time. Even in localizing fibroid too, you should know the plane with which you will send your images to us for us to be able to interpret or interpret or localize the fibroid you're talking about. Now look at this. This is the sagittal view. The best view to localize fibroid is a transverse view. Okay? It can tell you whether it's anterior, posterior. It can even tell you the location where actually it is with respect to the plane of the uterus. Now look at this. This is the uterus. That's the endometrial plate. Of course, this is the fibroid. Sorry. Now, this is the uterus, sagittal view, and that's a fibroid as well. I can rightly say this is a subserous fibroid, and this is another subserous fibroid. So it's important to know. Now, sometimes when you want to talk about cervical insufficiency or some called cervical incompetency, the best view again is what? Sagittal view. So you need to know the view that is the best view for you to get the image clear for possible interpretation. Now, this is the bladder. This is the external os and internal os. Can you see the angulation here? V-shaped angulation here. That's a U-shaped angulation here. The stages of what? Cervical incompetency. Now, this is a case of localizing an IUD, intrauterine device. The best view is, if you have a 2D scan, the best view is what? The sagittal view. But if you have a 3D scan, the best view is what? The coronal view. Now let's look. But let's look at this. But two of them can still give the same level of what? Appreciation of what? Localizing the uterine sort of like intrauterine device. Now, this is the bladder here. This is the uterus in sagittal view. And that's the what? The copper T here in the cervix. So when you give us a full bladder as a landmark, you give us a sagittal view. If you send this image to us, anybody can interpret it and tell you this is exactly it is. And anywhere in the world, it is the same. Now, this is a coronal view of the uterus. You can see the T shape of the copper T. Looking at it, this is the cervix and this is the midcap. This one is a normal position there, what? Copper T. So looking at this one, I can really tell if it's actually in normal position or not. This is the internal os here. And there's no connection, direct connection between the inferior margin here and the what? Internal. So this is a well-positioned copper T in the coronal view. So talking about coronal view too, maybe you want to talk about uterine abnormalities, it can also give you help. Now look at this. This is a case of an arcuate uterus. You can see that's the mid cavity. Now sometimes I want to talk about localizing the cornual ectopic. The best view is what? The coronal view, as you can see in this case. This is the right cornual ectopic. I'm just giving a guide. No, there's a lot to say, but just give a guide. Now, if you want to localize an interstitial ectopic, the best view is what? Sagittal view. So, but my advice is that if you don't know the view to use, whenever you're sending an image, please give us the different views. Give us transverse view, give us a sagittal view with good image and send to us. We're able to interpret it for you, or anyone else can do that. But if you just want a single view, this can give you a best guide. Now, look at this. The uterus, the endometrial plate, of course, that's the pregnancy here. The uterus, endometrial plate, of course, the pregnancy here. Now, this one can be mistaken for an ectopic, but it's not an ectopic pregnancy. That's the uterus, and of course, the gestational sac and the fetal pole as well. So, what are the things to talk about? Anatomical landmarks. So, what are the anatomical landmarks? What anatomical landmarks look like? In the uterus, the anatomical landmark is the bladder. Okay, this is the uterus. Are you getting that? In sagittal view, the anatomical landmark is the bladder. This is another uterus here. This is the antevater uterus and the retrovater uterus. So giving us an anatomical landmark can even give us a guide on how to identify what we are looking at for. Now, what are for example, we want to identify the gender. Once I know that this is the femur, I know that this is the what? The phallus. Of course, the penis of the gender. And this is another one as well. What if you have a case like this? If I ask you now, which gender is this? So I will say female. It's not a female gender. There's no landmark here. Now look at this. This is another thing that looks like a female gender. Of course, it's the head of the baby. So you don't expect the labia to be at the head of the baby. So anatomical landmarks are important when you're sending images for possible interpretation. Now this one is a case of an enlarged prostate. That's the urinary bladder. Okay, this is another prostate with a calculus at the prostatic urethra. So, but this is the bladder here. With this one, I know we're dealing with the prostate. So the landmarks are important, and the views give you a better view. Then talk about the landmarks as well. This is the bladder and the uterus, and that's an ectopic pregnancy at the frontal end of the uterus. Now, how do I identify which ectopic is this one, whether it's the right ectopic or left ectopic? I cannot get that from a sagittal view, but rather I'll go from a transverse view. As you can see, this is the uterus here, and this is the ectopic pregnancy. Because it's on the right side of the uterus, I can rightly say it's what? The right ectopic gestation, because from the transverse view. So these are some other examples that landmarks are quite important. For transvaginal scan, it's a different ballgame entirely. We use the internal iliac vessels to identify which of the ovaries we're trying to look at that point in time. Now, with anatomical landmarks, if this is the liver, definitely this is the right kidney. If this is the spleen, definitely this is what? The left kidney. So these are quite important. The landmarks are important. Now, someone sent me a scan. I have a lot, but I won't because of time. Let me just focus on this. He said, "Good day, sir. Can you review the above scan result that I carried out in a suspect pregnant woman?" And she said she's 10 weeks pregnant. But the dark spot I've seen at the cervix is my concern. Now, this is the pregnancy here. That's the uterus. And that's what he's concerned about. The question I asked him is this. I said, "Which view are you giving to me?" He said, "Transverse view." I said, "No, that makes it wrong." So for you to know, to look at the service and appreciate the service very well, you must go for a sagittal view. And when he did discover the sagittal view, he now discovered that actually the service was free. This one was actually at the right adnexia. So that now solved the problem. So it's important for you to take note of that. Then, if you're scanning and you don't have the landmarks around you, please label the organ you're sending for review. Look at these two views now. I can't say which one is the bladder and which is the cyst, unless it is what? Labeled. These are the ovarian cysts. But looking at this cannot define what we're looking at for. The urinary bladder, this is a urinary bladder. But I cannot say unless it is labeled. Please label it to make it easy for what appreciation. These are other examples as well. Then you can send videos to us. Like you can see, there's a video of an ectopic pregnancy. That's the mid cavity. And that's the videos. A live video can be sent, or the recorded one can be sent for review as well. Now, what are the precautions you need to take when sending images for possible review? What are the precautions? 1, good resolution. Please take notes. 2, you must have the scanning techniques or skills or expertise or experience on the scan you're trying to conduct. If you've not done breast scan before, don't send a patient for breast scan for review because you won't know how to get the image. So that will not be nice. Then, of course, you should look out for be conversant with the machine you're using. Then, of course, look out for real-time on-the-spot ultrasound scanning and reviews. Please, if you are doing that, if you are scanning a patient in real time, take consent from the patient to be quite nice. And you must always have enough data before you can send patients for review so that your data will not go off when the review is being done. Well, and there's need for you to have updates as well. Thank you very much. I'm your host, Dr. Festus Osai. Remember, the Lagos Ultrasound Scan Training Workshop is just by the corner. Register early and benefit. Thank you very much.